So today we're going to be talking about foot drop. We're going to talk about the symptoms, how patients present, the workup in the office, and the various non-operative and operative treatment options. So what is foot drop? The way you can think about it is you no longer have the ability to dorsiflex your ankle. So you can't pull your ankle up towards the rest of your foot. It causes a patient to trip and fall. They have to walk with an altered gait, so they have to lift their leg up really high in order to clear their toes off the ground. So it can be really dangerous and put a patient at risk of falling and sustaining another injury. So usually when I see a patient, they come into the office complaining of weakness that started either from a cause or perhaps they really don't know why. The more common causes are progressive neurologic disorders. It can be caused from traumas, such as a simple ankle sprain or a major trauma that requires surgery. It can be caused by postoperative complication. I see a lot of patients with spine disease, so compression of the nerve. But the good news is there's lots of ways to treat this, okay? So after you come into the office, we do a thorough workup. We can get an MRI to make sure there's no tendon issue. And then we get an EMG, which is a nerve test, and it helps us evaluate the nerve to see how much damage there is. So usually after we have a diagnosis, we can start treatment. And we always start with conservative management. And the reason for that is because we want to give that nerve about 9 months to recover. So the first thing we do is we help you ambulate without being at risk of falling. So we put you in a brace. This is called an AFO. And the brace, there's lots of different kinds, but it basically helps hold your foot in 90 degrees. That way you have a lower risk of falling and tripping. The other thing is we really need to maintain your range of motion. So we have to make sure that even though your dorsiflexors, so the tendons in the front of your ankle, are not actively pulling your ankle up, you still need to passively be able to move your ankle up. So doing physical therapy and a lot of stretching is imperative. Then we start to talk about surgery. And surgery can be really helpful because it not only puts your foot back into that 90-degree position, but it can give you a little bit of range of motion and a little bit of strength. So what that surgery is called a tendon transfer surgery. It's where you borrow the posterior tibial tendon. So it's a tendon on the inside of your ankle. And we actually wrap it around the tibia and then insert it into the lateral side of the foot with an anchor. And so that tendon, which is still powerful and strong, is now able to dorsiflex the foot. So usually I tell patients you're going to be in therapy for about 6 months, but right away, the first time I see them in the office, I ask the patient to dorsiflex, right? Something they haven't been able to do for months, years, and they're able to do it. So just already that mind-nerve connection is there, which is pretty great. So if you do feel like you're experiencing weakness and an inability to dorsiflex your foot, or you've already been diagnosed with a foot drop, come see me in the office and we can do a workup and get you on the path to treatment.